All right, hello everybody. It's Dr. Alex Earl here, and it's Hump Day with Dr. Alex Earl. We're here at Pure Plastic Surgery, and this is the time I get to talk to you guys about plastic surgery, different topics, and of course answer all your burning yearning questions. All right. So today it's going to be a little bit shorter than our usual lives, a little bit under the 30 minutes, but I think we're going to be able to talk pretty comprehensively about breast reduction. And then, of course, I'll be happy to answer all the questions that you may have, all right? So, one thing that we actually don't talk about that much is the breast reductions. I know we spend a lot of time talking about breast augmentation. We talk about implants, we talk about breast lift, but we don't spend too much time talking about breast reduction. So I wanted to bring it up here today because it's actually one of the surgeries where we have like the highest satisfaction rate of almost anything that we do. Like patients are super happy after their breast reduction. And that's typically because they're so symptomatic before they have their breast reduction, okay? And sometimes they've been carrying this weight and carrying this pain and this strain for pretty much their entire life, right? And so when you finally like make that decision and get the breast reduction, it is such a relief. And that's what we found just overwhelmingly like across the board with most of our patients that undergo this procedure. And just to be clear, today what I'm talking about is a breast reduction and of course no implant. I'm not talking about adding any implants. We're talking about a straight breast reduction where we're actually reducing breast, loose breast skin. We're reducing excess breast tissue and of course lifting the breast. So one of the questions that I always get is like, Doc, I want a breast reduction, but I also want to lift. And actually, they always go together. So that's one thing that I want you to understand. When you get a breast reduction, you automatically also get the breast lift, okay? That is part of the breast reduction automatically. You don't have to like ask for it separately. Some of the very same methods that we use for breast lift are similar to the ones that we use for breast reduction, okay? The difference is that when we do the breast reduction, we're removing more tissue, more volume. So if we're doing just a straight up breast lift, a lot of times we're just removing excess skin and lifting the breast. Now when we're doing the breast reduction, we still remove the excess skin, we still lift the breast, but now we're gonna be removing a lot of excess tissue, a lot of volume, making the overall breast smaller and most importantly, lighter, okay? Because, when you have large breasts, right, there's this weight that you're carrying 24/7, and it can lead to symptoms, right? And so what are the typical symptoms? The symptoms are usually back pain, especially up, in the back, like in the upper back. So a lot of back pain, and neck strain. So it can cause a lot of strain in the neck in these, what we call the trapezius muscles up here. So it can be a lot of neck strain, a lot of back pain. A couple other things which I didn't write down here. You can have what's called shoulder grooving. So that's when the bra, because it has to carry so much weight all the time, creates these like very, deep grooves in the shoulder, which, become permanent and become very visible. And that can certainly happen as well. So you can have shoulder grooving, neck strain, and back pain. Those are your typical symptoms of large breasts, or what we call macromastia. So large breasts, the kind of technical or surgical term for that is macromastia, okay? And if you have extremely large breasts, which can sometimes happen, that's called gigantomastia, like gigantic breast, gigantomastia. And these are actual, medical surgical terms, okay? So macromastia and gigantomastia, okay? So if you have that, if you have large breasts, if you're having back pain, if you're having neck strain or shoulder grooving, then you are a good candidate for a breast reduction, okay? Now breast reductions, you should know that sometimes they can actually be covered by your insurance carrier. Now this is gonna vary it's gonna vary greatly. Why? Not everyone has the same insurance carrier. Not everyone has the same, size of breast. Not everyone has the same symptoms. There's a lot of variables that go into play as to whether your insurance carrier is going to approve this surgery or not. And if it does get approved, then I recommend you go to like a plastic surgeon, like in a hospital setting, like the way I used to do when I worked at Cleveland Clinic here in Florida. So as many of you may know, when I graduated from plastic surgery residency, my first job was with the Cleveland Clinic here in Florida. I was doing a lot of breast reconstruction and breast surgery then, and I would be doing breast reductions at that point in time that were covered by insurance, okay? Unfortunately now here at Pure Plastic Surgery, we don't take insurance, so we're not able to do that. It would have to be like all our other surgeries, kind of a cosmetic type case, okay? But what I have found is that patients absolutely love this procedure because they feel so much better afterwards. I mean, that back pain goes away, the neck strain goes away, the shoulder grooving starts to go away. They start to like sit up instead of being all slouched down like this all the time. They feel like it's a lot easier for them to move around, to exercise, and to do all these things. And so they're super, super happy with this procedure. Now, what does it typically involve in the operating room? It usually is that anchor type pattern. So the one where it kind of looks like this. That's typically what you need for most of your breast reductions. Because otherwise, if it's something less than that, it'll probably be just considered a breast lift and not a true breast reduction. So you are going to get that anchor type pattern. That means the scar goes all the way around the areola and then vertically down towards the bottom of the breast and then underneath the breast in that inframammary fold, okay? So you're going to have that anchor type pattern. Of course, like I said, the lift is kind of part of the procedure. It's automatically included with the procedure. It's not something that needs to be added on or anything like that, okay? But, of course, with all surgeries, there's the potential for complications or side effects, all right? And I'm going to say one of the most common things with this particular surgery is loss of sensation, okay? Now, I'm not saying complete loss of sensation, like completely numb, you can't feel absolutely anything, but there is to a certain degree some loss of feeling to the nipple and the areola after this procedure. Now, how much is very tough to tell. Like every patient is different. It varies a lot from patient to patient, and it may even vary from side to side. You may end up with more feeling on one breast than the other. Now, what I can tell you is that it's always worse at the beginning. So at the very beginning, things may feel pretty numb, and then over the course of the first year, things may improve as some of those little nerve endings start to grow back in. Now, how much is it going to improve? Nobody knows. Is it going to go back to all the way to normal? Nobody knows. It's a possibility. But yes, you should definitely expect some loss of sensation, all right? The other thing that's very common, I put in the category of open wounds, is that in this spot right here, right in there, we call it that upside down T-point. Right in that upside down T-point, right in there, sometimes that can open up and create a small wound. This is actually also very common. It can happen, I would say, at least 20% of the time. The good news is that it's nothing to freak out about. Don't worry about it, okay? Do not freak out. If it happens to you, all you typically have to do is just put a little antibiotic ointment, a little gauze on top of that, and eventually it'll just heal on its own, all right? So, little triple point wound after a breast reduction or even a breast lift, okay? Nothing to freak out about. Listen to that again. Do not freak out. Okay, we just put a little antibiotic ointment, a couple of dressing changes, and it will heal on its own. Okay? All right, could you have open wounds other places? Yeah, but that's very, very rare. This is the point of the most tension, so that's where it typically happens, okay? Sometimes it can happen a little bit in this spot right here. So this little spot here where the vertical incision comes off the areola. If that happens, typically it's because the stitch is spitting out and it's a tiny wound there. Treatment is the same, little antibiotic ointment, heals on its own. If you do see a stitch, the stitch needs to come out. So that's something that you got to tell your provider, your surgeon, your clinic, wherever. Let them know, because then once you pull that stitch out, that's when the healing really starts to advance. Okay, as long as that little stitch is there, it's kind of preventing the healing. So if you do see what we call a little spitting suture or spitting stitch, you want to remove that stitch so then your body can then heal it. Okay, even if it's an absorbable stitch. You want to go ahead and remove it if it's poking out or if it's visible. Okay? All right, infection, of course, is always a possibility with any surgery. The infection rate is very low. It's about 1% or less. Okay? It's a very low, but it's not zero. So we do give antibiotics during and after surgery to minimize the risk of infection. All right. The thing that is most potentially worrisome, okay, is the possibility of nipple necrosis, which is bad. That's like nipple dies. Nipple turns black and falls off. Not a good thing, okay?
Zombie nipple.
Yeah, the zombie nipple. Yeah, well, fortunately, if you go to the right surgeon who has done this a lot, okay, and has the technique down and is able to preserve that blood supply, the risk of nipple necrosis is very, very small, much less than 1%. But that's not across the board. If you go to a surgeon who hasn't done this a lot, that risk might be significantly higher, okay? So this is why, even though breast reduction can be common and it can really help your symptoms and make you feel a lot better, you do want to go to someone who has quite a bit of experience with the surgery, right? Like almost anything, right? You don't want to go to just someone who like doesn't really do this a lot, doesn't have a lot of experience, because they can have a much higher rate of potential for nipple necrosis or nipple dying, which is not good, okay? Now, can it happen to me? Of course, but like I said, it's extremely rare. I may get one, maybe partial necrosis a year, maybe even less than that. I don't even remember actually the last time that I had one, okay? But it's definitely less than 1%, okay? If you go to someone who has a lot of experience with this procedure, okay? All right, and then last but not least, in terms of the care, you know, for the first 6 weeks, please take it easy. So no heavy lifting, no strenuous activity, no swimming or submerging the breast in the water for 6 weeks, okay? The other thing you're not gonna do in the first 6 weeks is wear any underwire. So no underwire bras for the first 6 weeks, okay? All right, questions, let's go.
Do you recommend a BBL or breast lift first? Also, how long between the two procedures?
Great question. And I like this question because it means you've been listening and you know I don't combine those procedures. So thank you very much. And I don't combine them because of the recovery. So yes, I do separate out the procedures. And for these two particular procedures, you can choose which one you want to do first. I'm actually okay doing it in either way. So you can do your BBL first, or you can do your breast lift or breast reduction first. And then they're separated out by 3 months, okay? This is different from when you hear me talk about tummy tuck, right? All of you that hear me talk know that I always say do your tummy tuck first, right? So, but if we're not doing a tummy, right, so it's not a mommy makeover, we're not doing breast and tummy, we're just doing breast, then it's okay. You can do it either way. You can do your breast first, or you can do your BBL first.
Esta no es una pregunta, pero quiero decirle que usted es el mejor cirujano.
Oh, bueno, muchas gracias. Lo agradecemos muchísimo.
Okay, a little bit more information about the skinny BBL. I'm thinking about a tummy tuck first, but not sure if I'll have enough for a BBL.
Yeah, of course. So we get this question a lot, and people hear it because they see it on social media and other things, or other people, you know, when people say that you're not going to have enough fat after your tummy tuck, that is a myth. Okay, it's a myth. I don't know why it's out there, but it's a myth. It's not true. I have never in my 6 years here at Pure Plastic Surgery, over 5,000 procedures in total, over 3,000 BBLs, I have never, ever not had enough fat because I did a tummy tuck before. Okay, never, 0 times. All right, so that should tell you something. So yes, if you need your tummy tuck, have your tummy tuck first. Like I said, I always recommend doing your tummy tuck first. Get rid of that excess skin, get rid of that muscle weakness and that muscle separation. All right, get things really tightened up and nice in the belly area, and then come back for your BBL, even if it's a skinny BBL. Okay, it's not going to be a problem. All right, what else? One more?
Yes, one rapidito.
Okay, one rapidito. Let's go.
Okay. Can a breast lift happen with a fat transfer?
Can you do a breast lift combining that with a fat transfer? So
to the breast.
Yeah, to the breast.
Yes.
So the overall answer is like, can it happen? Yes. Is it my recommendation? No. But other surgeons do it, and and they feel like it works. Maybe it works better for them. I'm not sure. I don't think it's the best way to provide volume and to like reshape the breast. I think it's better to do that with an implant. So my recommendation is to combine the breast lift with an implant. And it doesn't have to be a big implant, it doesn't have to be a huge implant. It just has to be an implant that can provide some nice fullness and roundness, and especially in that upper pole of the breast, to create like that nice upper pole, that nice cleavage. And an implant does this a lot better and a lot, and in a way that you can really expect, the result a lot better with the implant as opposed to the fat transfer. The fat transfer, first of all, you cannot really put that much fat into the breast. It doesn't have a great blood supply, so typically the most that you can put in is maybe 200, maybe up to 300 cc's, but definitely not more than that. Otherwise, that fat's just going to die. It's going to cause fat necrosis and fatty cysts, which can then become a problem because they can become like little balls of scar tissue, which can then be confused in a mammogram or an ultrasound. If it's potentially they confuse it with potentially a mass or breast cancer, which can lead to unnecessary biopsies, right? So I think it's best to just avoid all that. And if you want to have some more volume with your breast lift, then use an implant. Okay? All right. Awesome. Well, short and sweet for today, but this is a great topic. We don't talk about it a lot. We kind of went over it pretty comprehensively. So if any of you are thinking about a breast reduction, I would just say just do it, okay? Of course, I would love for you to come and do it with me, but just in general, just do it. Why? Because you're going to feel so much better afterwards. You're going to feel like free, basically. You're going to feel like you can now just do all the stuff that you wanted to do. You can be more active. You go jogging, go to the gym. No more back pain, no more neck strain. It's a highly, highly recommended operation, okay? All right, guys, I look forward to seeing you all next week on Hump Day with Dr. Alex Searle. I'll see you then. Take care, everybody. Ciao.